Fred here has his abdomen region all taped off to be able to show us the muscles of the abdominal pelvic region. So first off, we have our most superficial layer, and that is the rectus abdominis. That's this purple muscle. It is a parallel muscle. Parallel muscles are usually really weak, and therefore the parallel muscle is divided into sections, or what you would find as PECs. This is what gives us the six-pack effect. So when someone has a decreased amount of body fat, what you'll see is kind of a bumping or pack effect, and that's just because these intersection tendons break up this long parallel muscle to make each of these sections stronger. What you find in the middle here is the linea alba, and the linea alba is a location for all of these muscles to attach to. So if we were to lift one side of the rectus abdominis off, we then will find this green muscle right here that is coming from the ribs, coming down into the linea alba as well. Now this one is going from the external side to inward towards the pelvic region. This is going to be our external oblique or external abdominal oblique. That is the second layer of it. The third layer is this blue layer, what we're going to call as our internal abdominal oblique. Okay, so the internal, it starts from the pelvic region and goes inwardly. This is going to be the third layer of our muscles. So it goes the rectus abdominis, external abdominal oblique, then the internal abdominal oblique. Each of these are going to be inserting onto the linea alba. Now, if we just peel this one back, you can see this yellow muscle right here, and that's the transversus abdominis. Now the transversus abdominis isn't just in this small section, it's going to be throughout the abdominal pelvic region. Just to be able to show us without overwhelming Fred with all of the tape, I had it just sectioned off right here. But if you look closely at which directions the fibers go, the transversus abdominis is in a transverse plane, or they're going perpendicular to the body. The internal obliques are going inwardly, the external obliques are going outwardly or externally, and then the rectus abdominis is straight up and down or parallel to the muscle, or to the body, excuse me. Then, if you look right back in here, we have this muscle that is going to be on the iliac crest. We have the iliac crest right here, so it's going to be on the iliac crest, and it's going to go upwards. It's just this small quadrant of a muscle on both sides. In fact, the kidney sits right directly in front of it, or anterior to this muscle. That is the quadratus lumborum. And then lastly, what we have is this muscle that's right on up in here in the rib cage. That's the diaphragm. So the diaphragm helps us with breathing. As you inhale, the diaphragm is going to push down, allowing the lungs to expand with air, and then when you breathe out, the diaphragm is going to lift on up. We have the PEC Major and the PEC Minor. These are located up on the chest region, and you can see that the minor is much smaller than the major here. Sticking with the minor, it originates on the ribs 3 through 5, and then it's going to insert right over here on the coracoid process of the scapula. So if it's inserting on the scapula, that means it's going to have something to do with moving the scapula. In fact, what it does is it depresses and it protracts the scapula. So if we were to do an exercise or some kind of movement with this, imagine doing a push-up and then you're going to do a +1. So I'm just adding a little bit to it, right? You're just extending a little bit further. So if I'm on the side doing a push-up, I'm here, I go down, up, and then I'm going to extend just a little bit more. See how my scapulas kind of pull outward here? And it dips a little bit. That is part of the pectoralis major working right there. So that is pectoralis major. It is going to depress and protract the scapula. Now the pectoralis major, I'm sorry, that was the pectoralis minor. The pectoralis major is going to originate on the clavicle. Notice how it comes wrapping up in here. the clavicle, the sternum, and the costal cartilages. So it's a big muscle. It kind of fans out. And then it's going to insert on the greater tubercle and the intertubercular groove. Being the fact that it inserts on the greater tubercle and the intertubercular groove means that it has to do something with the humerus. In fact, what it's going to do is it's going to medially rotate, flex, and adduct. Okay, so I'll do it again. So medially rotate, adduct, and flex. Basically what that's doing is our bench press, right? We're medially rotating, we're adducting or closer to the midline of the body, and then we are flexing, bringing it on up. And then you would hold the barbell here and do your bench press. So that is your PEC Major and your PEC Minor. Here we have the pectoralis minor and the serratus anterior. The pectoralis minor, again, is going to originate on the ribs 3 through 5, and then it's going to insert on the coracoid process of the scapula. Whereas the serratus anterior is going to originate on the ribs 1 through 8, and then it's going to insert right underneath the scapula. So it's going to actually go on the anterior side of the scapula, and then it's going to insert on the border, medial border specifically of the scapula. Okay, so both of these muscles, the reason why I have them paired is because they both do a similar function. And that function or action is going to be protraction of the scapula. It's going to pull the scapula outward instead of going towards the vertebral column. So it's going to pull the scapula outward. Think of this like your boxing muscle. So when you go to throw a punch or box, you're going to pull the scapula outward. So I'm here and it's going to wrap around here, right? Whereas if I pull together, I'm going to be bringing that scapula inwardly. So it's going to go medially towards the vertebral column. So that's why I paired the two together of serratus anterior and PEC minor, is that they both protract the scapula. Now the PEC minor is also going to depress it a little bit. So it's going to pull it down and protract the scapula. These three muscles are muscles that are going to move the scapula. So we have the levator scapulae and then the rhomboideus muscles. Now the levator scapulae is going to be on the, it's going to originate on C1 through C4. So cervical vertebrae 1 through cervical vertebrae 4. And then it's going to insert on the superior border of the scapula. When this muscle contracts or shortens, it's basically going to pull up from the insertion side. So it's going to pull upwardly, and that is going to cause the scapula to elevate or move upwardly or superiorly, excuse me. So the levator scapulae elevates. It pretty much says it in its name. Then the next one that you have is this tiny little muscle. That is the rhomboideus minor. Whenever you have a minor, you're going to have a major, and vice versa. Whenever there's a major, there will be a minor, and the major is always going to be bigger than the minor. Additionally, the minor is going to sit superiorly from the major. So the minor right here is going to be originating on C7, so cervical 7, and T1, thoracic 1. And we know this because thoracic 1 has the rib next to it. Okay, so if I were to pull this back, you can see the first rib being right here, just kind of poking through, and then you have C7 right there. So it's going to originate on C7 and T1, and then it's going to insert on the superior angle as well as partial medial border of the scapula. When that contracts, it's going to pull upwardly as well as retracting towards the midline of the body or towards the vertebral column. Same concept for the rhomboideus major. Notice that the fibers aren't just running parallel like this or perpendicular to the body. Like if I were to have the muscle going like that, it's going at an angle and upwardly. So the thing is that when you look at these fibers, you want to look at the direction that they're going because that can tell you what they're doing on their movements. With the rhomboideus major, it's going to originate on T2 through T5, and then it's going to insert on the medial or vertebral border of the scapula, and that also is going to retract, so bringing medially, and elevating a little bit of that scapula. So again, we have the levator scapulae, rhomboideus minor, and the rhomboideus major, all going to be moving the scapula in an elevating motion, as well as the rhomboideus major and minor retracting. Here we have the trapezius. The trapezius is the superficial layer, and if I were to pull back the trapezius, you then would be able to see the levator scapulae, rhomboideus minor, and the rhomboideus major. The trapezius is going to have an origin of the occipital bone. It's not going to really move the occipital bone, but this is where it's starting. And then another starting point is going to be your C7 all the way down to T12. Notice that this is the last rib, so thoracic 12 is going to have the last rib on it. And that's going to be the origin sites of the trapezius. Notice that it's towards the midline of the body, and whenever you have something towards the midline of the body, that's going to be more of its stability point. Its insertion is going to be on the acromion of the clavicle, and then also too on the clavicle, and so that means that it's going to have some kind of action towards the scapula. So you have the acromion of the scapula, and from that the scapula is going to elevate, retract, and depress. So the action of the trapezius is elevate, retract the scapula, and then depress it. Imagine if you're doing like a lot of desk work, or if you're sitting, you're going to be hunched over like this. So we're protracting the scapulars, we're pulling them away. And then also too, we're having it elevated, which is going to be really tight there. So instead of being here all the time, you want to relax the body, elevate, retract, and then depress. So if I'm looking at it from here, I'm going to elevate, retract, and then depress. Hold it there for a few seconds, feel what it's like, and then kind of reset yourself and then loosen up. And hopefully you'll be able to remind your body of that position for your scapula. Here we have the latissimus dorsi and the teres minor, okay? So the latissimus dorsi is this large winged muscle. Okay, it is the largest in surface area of all muscles on your body. So it's the biggest muscle that you have. And from here, it's your swimmer's muscle. So it's going to wrap around. And if you were to look at like Michael Phelps or any professional swimmer or any swimmer at all, you might see these kind of like wings that come around on the side here. That is the latissimus dorsi. So the latissimus dorsi is going to originate here on the iliac crest, and then also have the T7, because we're in the thoracic region with those ribs. So T7 through T12. Now you may not be able to see it. If I lifted this up, you would be able to see that it's attached right here, and then it kind of divvies off to the iliac crest. So it doesn't follow along the rest of the lumbar vertebrae. So it stops at the T12 and the iliac crest for the origin point. Now for the insertion, it's going to wrap around, and because it's a swimmer's muscle, we swim with our arms. So it's going to have to insert somewhere on our arm. It's going to insert on the intertubercular groove. And I'll show you that here in just a moment. Now this little muscle right here, I like to think of this muscle as latissimus dorsi's little brother. It's the teres major. It tries to act tough, it tries to sound big, but it's this little muscle. And of course, whenever you have a little sibling, they do or want to do everything that you do, right? So teres major is going to want to act like his big brother of latissimus dorsi. So he's going to do the same functions and insert in the same location as latissimus dorsi. The origin point is going to be the axillary border or the lateral border, as well as a little bit of the inferior angle of the scapula. So here is teres major and latissimus dorsi. If we were to look on over here, I'll get in a little bit closer. So here we have the humerus, the head of the humerus, and then we have the tubercular, greater tubercle, and the lesser tubercle, and then these are going to insert right on the intertubercular groove right here. Hopefully you can see that. So here's the intertubercular groove. You can see that the lesser tubercle is here, and then there's this like little space or cavity where it lines down. And then The reason why I have the PEC Major on is because the fact that it is going to wrap around and go on the greater tubercle. So it kind of overlaps there, okay? And there's a reason to showing you all of these at the same time. So to focus on the latissimus dorsi and the teres minor, teres major. So when you're swimming, if you're going for a stroke, this motion right here, you're gonna medially rotate, right? Medially rotate towards the midline. You're gonna adduct your arm, and then you're going to extend. That's how you're gonna get the water to be pulled and have you moving through the water. So medially rotate, this would be laterally rotate, medial rotation, adduction towards the midline, and then extension. That is what teres major and latissimus dorsi do. It is on the posterior side, so it makes sense to extend the humerus. Now, the reason why I was putting PEC major on there as well is because if you think about it, we know that PEC major does our bench press movement. So we're going to medially rotate, adduct, and then we're going to flex because it's on the anterior portion. So it wouldn't make sense to have, since the PEC major is on the anterior side, it wouldn't make sense to have some kind of movement towards the back, right? And it wouldn't be functional that way. But the ones in the back are going to help with the extension because it's already back there. So these three have very similar actions, and that's why I pair them together. Just logically think about it between the three. The PEC major is in front or in the anterior position, so that helps with flexion. Whereas these two in the back are going to be in the posterior, and it's going to help with extension of the humerus. Here we have the deltoid muscle. The deltoid muscle is basically this triangular muscle that is going to wrap around the shoulder or the glenohumeral joint, and then it's going to insert here on the deltoid tuberosity of the humerus. So its origin is going to be on the clavicle, the acromion of the scapula, and then also to the spine of the scapula. And again, as I said, it's going to insert here on the deltoid tuberosity. Because it wraps around the glenohumeral joint or the shoulder joint and then inserts on the humerus, that means that it has to do something with this humerus. Well, with this humerus, what it's going to do is it's going to flex the humerus, it's going to abduct the humerus, and it's also going to extend the humerus. And the reason why it's able to do that is because it has the three different directions of fibers. And so basically, in the gym, if you were to work out your delts, you may see someone do front raises or flies, and then lateral flies and extensions or posterior flies. So that's basically what the deltoid is doing. Here we have the posterior side of the back and the neck. These are the muscles that are going to help with extension of the vertebral column. This muscle right here, it's a group of muscles. It's the erector spinae group. And so it is composed of the iliocostalis, the longissimus, so the long muscles is the longissimus, and then the spinalis group. You don't necessarily have to know those for at least my class of anatomy, but you may want to remember it for other purposes, and you can remember it by a mnemonic of I love standing, so the I for iliocostalis, love for the longissimus, and then standing for spinalis. Now, there are two muscles that are up here towards the cervical region. This blue one is going to be your splenius capitis. So we're going to think of when someone gets decapitated. I know that sounds really bad to think about it, but when someone gets decapitated, they get their head cut off right here, right? So capitis, capitated, that's what we're going to think of. So that's your spinalis capitis, or splenius capitis, excuse me. And then you have your semispinalis capitis. Okay, so the semispinalis is basically along the spinal cord or the vertebral column. And that one we're going to think of a semi-truck is going to be driving up into the vertebrae or along the vertebrae up into the skull. And so that's what you're going to think of with a semi-truck for the semispinalis capitis. Here we're going to do the quizzes, so go ahead and try to identify the muscles with the associated numbers, and remember that if you're not in the live session, you won't be able to physically type it in like we do during the live series. Answers are coming your way, so check it out. So the first one is trapezius, second being latissimus dorsi, third erector spinae, and fourth being deltoid. And here's the next image. Answers are coming your way, and here it is. The first one being latissimus dorsi, second sternocleidomastoid, third trapezius, and fourth pectoralis major. Your next slide of questions. If you need more time, feel free to pause the video to be able to really look at these muscles. Let's review those answers. Number 1 being sternocleidomastoid, 2 pectoralis minor, 3 serratus anterior, 4 pectoralis major, 5 rectus abdominis, 6 is going to be the external oblique, followed by the internal oblique, and then the transversus abdominis, as well as the deltoid. Let's look at a closer view of the abdominal region. Here are those answers. So here we go. Quadratus lumborum, internal oblique, transversus abdominis, rectus abdominis, and then, of course, the external oblique. Now we have muscles of the upper appendicular in the posterior region. Let's do this. All right, the first one, levator scapulae, latissimus dorsi, rhomboid minor, rhomboideus major, and then the teres major.